ओम धम धन्वंतरे नमः। रागादिरोगान् सततानुशक्तान् अशेषकायान् प्रस्थानशेषान् औत्सुक्यमोहार्थितान् जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै। Today, let us discuss about the echocardiography. Echocardiography is used to assess the cardiac function and detect the cardiac disorders. Echocardiography, also known as cardiac ultrasound, is the use of ultrasound to examine the heart. It is a type of medical imaging using standard ultrasound or Doppler ultrasound. The visual image formed using this technique is called an an echocardiogram or a cardiac echo, simply an echo. Echocardiography is routinely used in the diagnosis, management, and follow-up of patients with any suspected or known heart diseases. It is one of the most widely used diagnostic imaging modalities in cardiology. It can provide a wealth of helpful information, including the size and shape of the heart, internal chamber size, quantification, pumping capacity, location and extent of any tissue damage, and assessment of valves. An echocardiogram can also give physicians other estimates of heart function, such as a calculation of the cardiac output, ejection fraction, and diastolic function, how well the heart relaxes. Echocardiography is an important tool in assessing wall motion abnormality in patients with suspected cardiac disease. It is a tool which helps in reaching an early diagnosis of myocardial infarction, showing regional wall motion abnormality. Also, it is important in treatment and follow-up in patients with heart failure, assessing ejection fraction. Echocardiography can help detect cardiomyopathies such as hypertrophic cardiomyopathy and related cardiomyopathy. The use of stress echocardiography may also help determine whether any chest pain or associated symptoms are related to heart disease. The biggest advantage of echocardiography is that it is not invasive. It does not involve breaking the skin or entering body cavities and has no known risks or side effects. Not only can an echocardiogram create ultrasound images of heart structure, but it can also produce accurate assessment of the blood flow through the heart by Doppler echocardiography using pulse or continuous wave Doppler ultrasound. This allows an assessment of both normal and abnormal blood flow through the heart. Color Doppler as well as spectral Doppler is used to visualize any abnormal communications between the left and right sides of the heart, any leaking of blood through the valves in valvular regurgitation, and estimate how well the valves open or do not open in case of valvular stenosis. The Doppler technique can also be used for tissue motion and velocity measurement by tissue Doppler echocardiography. Echocardiography was also the first ultrasound subspecialty to use intravenous contrast. Echocardiography is performed by cardiac sonographers cardiac physiologists or physicians trained in echocardiography. Recognized as the father of echocardiography, the Swedish physician Ling In Eltler, in 1911-2001, graduate of Lund University, was the first of his profession to apply ultrasonic pulse echo imaging in diagnosing cardiac disease, which the acoustical physicist Floyd Firestone has developed to detect defects in metal castings. In fact, Adler in 1953 produced the first echocardiographs using an industrial Firestone ultrasonic reflectoscope. Developing echocardiography, Adler worked with the physicist Carl Helmut Heinz, the son of the Nobel literate Gustav Hertz, and grandnephew of Heinrich Rudolf Hertz. Medical uses. Health societies recommend the use of echocardiography for initial diagnosis with when a change in the patient's clinical status occurs and when new data from an echocardiogram will result in the physician changing the patient's care. Diagnostic criteria of numerous cardiac diseases are based on echocardiography studies. For example, the differentiation of mild, moderate, and severe valvular disease is based upon measured criteria. Another example is the estimation of heart function by the left ventricular ejection fraction (LVEF), who has vast uses including classification of heart failure and cutoff of the implantation of implantable cardio cardio defibrillator. Defibrillator. Health societies do not recommend routine testing when the patient has no change in clinical status or when a physician is likely to change care of the patient based on the results of testing. A common example of overuse of echocardiography when not indicated is the use of routine testing in response to a patient diagnosis of mild valvular heart disease. In this case, patients are often asymptomatic for years before the onset of deterioration, and the results of the echocardiogram would not result in a change in care without other change in clinical status. Echocardiography has a vast role in pediatrics also, diagnosing patients with valvular heart disease and other congenital abnormalities. So, an emerging branch of fetal echocardiography, which involves echocardiography of an unborn fetus. So, today we have discussed briefly about echocardiography and how it is helpful in the correct diagnosis of a cardiac disorder. It may be wall thickness, it may be cardiac output, it may be left ventricular ejection fraction. So all these, by studying all these, you can have an idea about the status of the heart and detect the serious cardiac disorders. So, thank you for patience.